Buddy, guess what time it is? It
Howdy
is
doody time.
2 minutes before, well, it's like 4 minutes after 2 Eastern Time, and that means it is time for your favorite medical show with Dr. David Klein. We call it Stages of Life Radio. Now, we're not caught up with the radio just yet. We got a couple of minutes of news, speculation, things like that, weather, traffic, and
Ticking people off for a fee.
pretty much, yeah. I'll pay for it.
It's good.
So anyway, there's Dr. Klein. What? Oh, look at that. And today, it would appear that you're going to talk about anti-aging so that you can feel good about yourself.
Yeah, and it's not about dying young. Okay, so, I mean, really, you got two choices. You can either grow old or croak. No, it's actually not. It's really more about performance and what can you do now, because you can't go backwards. What can you do now to start to decrease the depredations, the problems that you've had with aging, things that have really started to tear you up from the inside out or from the outside in. Ooh. And there are things that can be done, should be done if you're so inclined, to give yourself a better shot at A, living longer, B, collecting a whole lot more in your Social Security, D, behaving more like my dad did through his 90s.
Your dad was getting it.
My dad was getting it. I mean, when he was 91 years old, I asked him, I said, "Hey, Pop, what more can a son do for his dad? Dad, can I get you some Viagra?" Because he was one of just a few living guys in this retirement community. And he looked at me incredulously.
Seriously, son?
Yeah. He goes, "No, hell no. That's for old people." My dad was my hero.
You're like 92?
92.
Way to go, Pops.
Yeah, to this day, he wouldn't tell me how many he got. But, okay, he was quite the guy. He's my guy. Chip off the old block.
Sexually transmitted diseases and such, Lady Lakes,
Yeah, it happens. Okay?
Villages get a little crazy up there. It's
Well,
true.
no, I mean, if you were going to retire with some money, okay, would you not want to enjoy yourself?
Yeah.
I have lots of patients from the villages.
Crazy answers.
Yeah,
to
they
these
come down
silly
here.
Questions.
Yeah, they look for. They not only are they looking they're looking to get more. Actually, it's very interesting. It's a very, very different attitude there. So, but frankly, the STD incidence up there is no different than it is in Orlando, which is very high, actually.
Yeah, it is.
So, just so you know, these old people,
Paid attention.
they do okay. These old people, many of them are younger than I am.
Really?
Yeah. I think you only have to be 50 to get in up there.
Yeah, I know most of them are 55 and up communities, which is nothing. I mean,
It's not that old.
no. Speaking of someone who's now 55,
Yeah.
there you go. So, my neighbor across the way is like, "I heard you bitching about your landlord being here and fixing all kinds of stuff."
Yeah,
And you guys like wandered in. You're like, "Whoa, what's going on here?" Work in progress, my friend.
yeah. We stepped in as you were stepping on.
Yes. And on that note, I shall go clean my sandals, and we're going to catch up with iHeartRadio. If you are watching us on Facebook, that's great. Appreciate that. Share if you care, and we'll take your questions during the breaks. Otherwise, just about that time.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212. Or text 23680.
It's always fun, isn't it? Isn't it just a fun day Sunday when it's time for you to be here and do Stages of Life Radio?
Of course. Where would I rather be?
I think you'd rather be right here answering people's questions. That is Dr. David Klein from Stages of Life Medical Institute. If you're listening on the radio, 93.1 FM, 94.1 FM, or AM 580, you can always switch over to the iHeartRadio app. Just search for News Radio WFLA Orlando. We thank you for coming here every Sunday afternoon at 4 o'clock. Today, Dr. David Klein said, let's talk about anti-aging so you can feel good about yourself. Please explain.
Well, it works a little something like this. As we get older, we start to fall apart in certain ways, sometimes from the inside out, sometimes from the outside in. And what anti-aging medicine is all about is taking things from our food, things in our environment, sometimes medications, that will either reverse the aging or slow it down substantially. So if somebody came to you and said, well, gee, you're developing osteopenia, soon to be osteoporosis, you're going to start losing height. as soon as your back starts to crack, you're going to have pain the rest of your life. Or we can treat it and prevent it. Is that not a good idea? But that's anti-aging medicine. You have a problem with hormones. You can't sleep at night. You have constipation. You're irritable. You probably are anyway, right?
Yeah.
These are things that you can fix, you can correct, not only with what's in your diet, but sometimes with nutraceuticals. It's very, very interesting. So Hippocrates once said, let food be thy medicine, and let medicine be thy food. And that is the basis of orthomolecular medicine, sometimes known as anti-aging medicine. And so what I'd like to do is I'd like to take a moment to describe what that's all about. Now, why is it? Why is it that we have to take any supplements at all? When I was in training, I was told that Americans have the most valuable, the most expensive, and most wasteful urine in the world, because we would take lots and lots of vitamins and minerals and pee it all away. The fact of the matter was that I was taught wrong. It doesn't matter what goes out. What matters is what goes in and what your body consumes. So if you look at the rainfall that might or might not be happening right now, in order for any of that to get to the roots of your grass, a full 3/4 of an inch has to fall in order for 1/8 of an inch to make it to the roots. Is the rest of it wasted? The fact is that it takes a certain amount of anything to get the job done. If you're into the direct mail business, you'll know that it takes 10 to 15 mailings in order to get a 6 to 7%, if you're lucky, response rate. Yet that's what you do. If you're selling advertisement time, you really understand how this thing works to bring people in. When you're looking at vitamins and minerals, especially minerals, okay, vitamins, they absorb pretty well. Minerals do not. So in order for you to absorb, let's say, iron, how much iron do you think you need? So you look at the bottle and it tells you what the RDA is, which is absolute nonsense. Why is that? Okay, because your body ages, your gastrointestinal tract ages. So as a teenager, when you're eating garbage, you grow. And yet when you're an adult and you eat well, you eat properly, you eat everything you're supposed to eat, you start to diminish, your bone starts to melt away. Is this just patently unfair? Okay, no, this is the way it is. The body's ability to absorb from the environment decreases with age, and that is one of the aging processes that we look at. So in order for you as an individual to get as much calcium as you need as a 50 or 60 or 70-year-old, you may have to take 4 to 5 times what a teenager takes. Is it waste? No. The teenager absorbs 1% of what's presented. The other 99% ends up in the pee. Okay? So, but as your efficiency decreases, you may need to take 4, 5, 6 times or more in order for you to absorb the gross amount that's necessary to get the job done. So as a machine, you become a little bit rattled, a little bit less efficient. So you just have to take this into consideration. The good news is that vitamins and minerals are not terribly expensive. So you can, quote unquote, overdose yourself and yet not spend a lot of money doing it, and certainly not to get into any trouble. There's certain places in vitamins and minerals that you have to be wickedly careful. And this is where guidance comes into it. You need somebody that knows what they're doing so that you don't end up getting into trouble. Vitamin A is one of them. Too much vitamin A, you'll end up with some brain issues, let's say. Okay, not good ones. Vitamin E, hip fractures. So vitamin A and vitamin E are problematic, but vitamin D, I was taught, oh, that's a problem. You can't take, if you take too much vitamin D, your liver gets damaged. News alert, okay? We're on a news station. News alert. Vitamin D is not a vitamin. It's a hormone. And you can't take too much vitamin D. It doesn't happen. There's no toxicity to it. So what about vitamin K? Pretty much the same thing. You can get a little bruisey with it, if you take too much, but for the most part, it isn't. But the place where you'll get into damages with vitamin A and E, so you just have to watch that. And you have to be careful with certain minerals. So the minerals actually cause the problem, and that's where having an expert helping you through the backyard of life, keeping you away from those dog patties, is where things work out. What does it take to do that? It takes somebody that has an eye for it, understands what's good and what's bad, and then dragging you by the shoulder, elbow, ear, or whatever convenient appendage might be, to pull you along to make sure that you get what you need, how you get it, where you get it, in the proper way, proper dosage, and oddly enough, in the right mixtures. So zinc. Oh, everybody's out there taking zinc now because it's helpful with the immune system. Congratulations, you got it 1/10 right. Okay, so zinc is helpful with your immune system if you happen to be zinc deficient. If you're not zinc deficient, you can just end up costing yourself your olfactory lobe and some other problems. Zinc can, in fact, become toxic. Zinc and selenium need to be taken in the right ratios because selenium can cost you your life. But if you don't take enough of it, you become hypothyroid, gain weight, and have all kinds of dumpy problems. So things have to be taken in the appropriate amounts and in the right context. So what do I talk about? Context. So if you're a gardener, okay, and your plants are looking a little anemic, they start turning a little yellow. So if they're palm trees, if you're listening to us from Florida, you know this real well. Palm trees, that's a magnesium issue. But elsewhere, your grass is yellowing out, it's usually an iron issue. So what do you think you're going to do? Go out there and throw ground up iron filings out there or rust? Doesn't work. Okay, because in order for iron to be absorbed by living creatures, it has to be in what's called an organic chelate. So you need to either use blood meal or something similar for your plants. And you are no different. So in order for you to get iron, how do you do it? The iron has to be combined with an amino acid. And that's what it's all about. So anti-aging medicine, you identify what pieces are wrong and you fix it. You replace them. Ratios, very, very important. So I like to look at the human body the way that I used to look at engines, when I was still a mechanic. And so you have 8 cylinders, 12 cylinders, some cars 16 cylinders, okay? Doesn't work if 1 or 2 of them don't fire properly. They have to be in the right order. They have to fire in the appropriate sequence. They need to fire the same, pretty much. Otherwise, it goes out of balance. The more complicated the engine, the easier it is to go out of balance. So if you think a car with 8 cylinders is a complicated matter, I want you to imagine a car with 5,000 cylinders, and everyone has to be exactly right with regards to the others. And as we get older, they start to break down. That is pretty much what we do with anti-aging, is to figure out of those 500 cylinders, and believe me when I tell you there's many more, 15,000 is a little closer to it, but 500 really important ones, you have to look for the top of the list, and you go after those first. After that, most people get better. Most people start feeling like $1 million. But not everybody's the same. So at stages of life, what we do is we focus on hormone balance, because that's the body's commanding control mechanism. Nutritional medicine, replacement of the pieces that are missing. All right. And then if we have to, we go ahead with your basic prescription medications, because sometimes, in fact, not all that infrequently, it's less expensive. So how about let's do it cost effectively and get it done?
All right, we're going to take your phone calls when we come back from this quick break. We've got Steve on the line calling about carpal tunnel.
Cool.
407-422-1212. You're listening to Stages of Life Radio. I got like that tongue held over there. Stages of Life Radio with Dr. David Klein. You can follow us on the social media at Stages of Life Medical Institute. We'll be right back. You're listening to News Radio, WFLA Orlando. Yay! Where'd you go? Just ran away?
Well, I just sent her off to get some water for me.
No, okay.
Yeah, allergies.
right?
Yeah, I'm fine.
Oh, it's bad out
Oh,
there.
it's terrible.
Yeah.
So are we 580 or 540?
Please. Did you write 580 on there?
No, you said 580.
No, I didn't.
You did.
I did not.
You did on the intro.
No way.
Yeah. Wait.
Did I? Somebody go back and check for me.
I'm thinking I've got this written wrong.
Are you sure?
I'm 100%.
Guys, somebody help me out here.
100% positive.
Linda Ball, you were listening. Did anyone hear me say 580 instead of 540? I've never said 580. But if I did, it was totally a subliminal mistake. Anywho, yeah, it's 540.
Good.
My God.
Well, I was thinking maybe I've been doing it wrong.
Iggy
all
wants
the
to
time.
know why you reference dog patties.
Yeah, because it came up through Guess Whose toes as she was out there walking.
No, it was just in my sandal. That was not. It was not. All right, folks, we got a lot of people watching us on the Facebook live feed as
Cool.
well as Twitter and on Twitch. And
Twitch?
Yeah,
Is there such a thing?
there's lots of things.
Oh, cool.
Yeah.
I know nothing about this.
Don't worry about it. Anyway, if you have any questions for the doc, we got 3 minutes to get to them before we get back. See, you didn't hear it either. If it was a Freudian slip, I did, Linda. There's another Linda that said, I said, you know what? It happens. Tomorrow I get to do the news. Actually, all week next week I get to play the role of Alan Spector. So should I be liberal? Just kidding.
What?
Well, no,
no,
I'm
you
just
have
saying.
an opportunity to balance things out again.
Oh, yeah, that might be fun. Yes, I did. Oh, you guys. So, you have any questions for the doc today? How are we doing with this whole COVID thing? Everybody all right? Yeah, exactly.
Yeah. Well,
Okay.
we're getting down some pretty low numbers right about now.
Oh, yeah.
And so the thing you need to understand about these COVID numbers, okay, well, for starters, they're wrong. Okay,
Yeah.
so what you're hearing is really, there's some, in the military, we had some marvelous acronyms for this stuff. But the fact is they're really wrong. The best of the numbers is really wrong. What's important is the trending. They're 2 weeks behind. And in some cases, a week and a half ago or so, they were 4 to 5 months behind. So the only number that's really going to make any sense is the leading indicator, which is the number of deaths. So when you see the number of deaths dropping like a rock, then you know things are starting to get better. And when an area like Orlando says, I guess we can open up our bars, then you really know, okay, that it's starting to lighten up. Okay, why?
What?
Well, my guess is they would be just too happy to stay closed until the day after election. But guess what? Guess who's going to have to open up? Who's going to have to open their schools up? So it's going to work out just fine. So COVID is on its way out. Now, back in January, we started talking about this. And what I suggested, okay, I was wrong. I was wrong by a month, okay, was that by July, things were starting to be hammer off. Okay, I missed it by 4 weeks. This is what you expect as the weather gets warmer. Now, I said, well, but people can catch it, and 4 or 5 days later, they're sick. Actually, it's probably going to be found to be untrue. It may take 10 to 14 days, just like every other respiratory virus, for it to start to show. So what do I think? I think we are going to do fine with this thing, and I do believe that we can start making vacation plans. Can you imagine that?
What?
Yeah.
Yeah,
okay.
like anyone can afford to go on
Well,
vacation. Good luck for
yeah,
you.
you could drive to someplace nearby, spend some money that you don't have, but at least go out and have some fun.
True. Keep in mind we are a radio station, YouTube. We pay for licensing fees for all of this music that we play, all 30 damn seconds of it. So please try not to copyright issue us, because we're taking care of that business.
We pay for it.
We do pay for the
This is
damn thing.
iHeart. They don't let us just swipe it.
No. Oh gosh, no. Not even this. I mean, I pay for it through connectionshow.com as well. So, and ready? What? We are back.
Sort of.
No, we're definitely back. Stages of Life Radio. Hello, News Radio WFLA Orlando on 540 AM, 93.1 FM, and 94.1 FM, always worldwide on the iHeartRadio app. Melissa Fox here helping out. Dr. David Klein from Stages of Life Medical Institute. Would you mind taking a call?
I'd be happy to take a call. What do we have today?
We got Steve. Steve, turn your radio down and listen to us, my friend.
We're going to hear ourselves here pretty soon.
Steve, turn your radio down.
Dr. Klein?
Yes, Steve. What's going on?
Hey, my daughter and my wife both are suffering from carpal tunnel symptoms.
All right.
And you mentioned a couple weeks ago you had a prescription that you
Yes.
recommend for this.
You got it. And it works beautifully. It takes about 2 minutes for it to work, if it's going to work, and it almost always does. And yeah, the medication is called. It's a compounded medication. The place that I have mine done is called Pharmacy Specialists. Okay, they're located in Altamont Springs, Florida. They're also a sponsor, not of this show, but they're a sponsor of the radio station.
You're a sponsor of this show.
Oh, they
as
are
well.
a sponsor of the show.
Yes,
Well,
as a matter
how
of
do I
fact.
know these things? But I've known these guys for 30 years. Okay, and they're very, very good. The medication is called ketoprofen 4% and gabapentin 5% in what's called Wrench, that's spelled ROENTSCH, anhydrous base. It's an oily goo. It comes in a tube. It costs, I think, $40 or $45. It'll last about 2 months. And you put a goober, sometimes known as a chocolate chip size, right on the wrist where the median nerve goes through the carpal tunnel, and you rub it wrist to wrist. The reason you do that is you don't want it on your fingers, but if you have carpal tunnel on one side, odds are you're going to have it on the other, unless it is caused by a fracture. But generally speaking, when you have carpal tunnel syndrome like this, it's going to either be due to repetitive use. Okay, so you sit there and you hammer with a hammer and nail all day long, ding, 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 ding. Or far more commonly is hypothyroidism. Hypothyroidism will cause bilateral carpal tunnel syndrome. And when that happens, generally what I do is I fix the symptoms with the keto GABA, which is what we call it. Keto GABA is a whole lot easier to say than ketoprofen 4%, gabapentin 5%, and wrench and hydraspace. Yeah. So keto GABA. And you apply, again, that goober to the wrist, rub it wrist to wrist, and then in about 2 minutes it starts feeling better. So what does the thyroid have to do with it? And this is really important, okay, that when you become hypothyroid, the nerve tissue, whether it's in the wrist, in the face, the feet, the knees, elbow for that matter, it will start to swell against a fixed opening. And then it will pinch itself very much like as if you had broken your finger and you had a ring on. The finger will swell, the ring does not expand, and it pinches itself. So it doesn't do a lot of good to do surgery for these things for the most part. What it does pay to do is to settle things down with the anti-inflammatory portion of it, the ketoprofen. The gabapentin settles down part of the nerve called the nervi nervorum. Now you're going to go, what the heck is he talking about? And this is really the coolest part about carpal tunnel. There's nothing else cool about carpal tunnel but this. And that's that the median nerve goes from your fingertips all the way up to your neck. So if that nerve were going to be damaged, it would hurt from your fingertips up to your neck. But why is it that your wrist and hand hurt? And it's because the nerves called the nervi nervorum in that portion of your wrist, that is where the nerves innervate the nerve itself. So it's not really the median nerve as much as it is the nervi nervorum. The goo works beautifully. It's inexpensive, but it is a prescription item. So if you want it, okay, so you can make an appointment with me, and that's fine. Happy to do it. Or you can try to convince your doctor to do it. But he's got to get it exactly right. The base is key. If you don't use the right base, it will not work. And you're going to go, well, why do you think that is? If you've ever used a bow and arrow, this is going to make a lot of sense. Okay, the business end of an arrow is actually the shaft and the fins. But in order to get into a target, you have to have the right tip. Okay, and if you use the wrong tip, it passes through the target, or it sticks in the target, or it bounces off. You've got to get it so that it hits the target. In this case, you'd be using a field tip rather than a hunting tip. You want to get it about a half an inch deep and not go all the way through into the bloodstream. So you've got to get it right. But does it work? Yes. Is it easy? Yes. How long does it take to figure this out? Generally about 2 minutes. So I had a gal in the office. You're going to love this one. Last week. Nice lady. So she had some dental work done. Okay, and this is a very common cause of trigeminal neuralgia. Okay, it's a nerve, similar type of a problem in the face. So they went ahead and worked on her, right? And they left her with exquisite pain in the tongue, lips, face. Okay, and she's been going on for several years with this. So she's been seen by some very good neurologists, okay, who could not figure this out. And they gave her this and they gave her that and they told her this and they told her that and they gave her expensive night splints and then over and over and over again. So she shows up. Well, I was told I should see you is what I heard from her. Why? Because I took care of one of her neighbors. So she shows up and I look at her and I go, okay, fine, I think I get it. So I asked her, I said, would you mind if I did a little experiment? Okay, well, she's been in pain so long she couldn't have cared if I cut her head off. So I took a little of the keto GABA and put it over a branch of the third division trigeminal called the mental nerve. And it sits in the chin. Okay, why? Because I knew from what she was telling me with which teeth were damaged, where the damage was going to be. And it's like we're right at the corner of your lips. Okay, and if you drop down about one finger breadth, that's where the foramen, the hole, where that nerve passes through. So I put a booger, a goober, a chocolate chip's worth of this stuff. Okay, it's about a half a gram. If I told you half a gram, you would know.
No.
Okay, but but if I told you a healthy sneeze worth, you'd figure it out.
Oh, come on.
And you put it right there. So then I started talking to her, tried to distract her, and then about a minute into it, I said, "Okay, how's it feel now?" So she pauses. I think it's getting better. After 2 minutes, it was gone. So I did one side of her face. Now I also know, okay, that if you got it on one side, you'd better do both sides, okay, because her anatomy is going to be a little bit strange. She's a little older, which means you start losing mandibular bone. It changes the anatomy. It makes it very common for this in folks over the age of about 60. So guess what? Same medication, very, very similar problem, but very different symptoms. So Steve, I hope that answered your question in somewhat less of a circuitous, surreptitious way.
Right.
But the fact of the matter is, it's actually a very easy thing. What I do for a living is very easy.
I've got Phil on the line here. I think we've got time to at least get started with him. Phil's from Apopka. He's about 82 years old, and he can tell you the rest.
Okay, so what's up, Phil? Phil from Apopka. Come in, Phil.
Hi, Phil.
Earth to Phil.
Yes, how are you?
Well, thank you. How are you doing?
Okay, I don't know, I'm not trying to play doctor, but I think I might have a problem with a fungal infection. Candida overgrowth maybe is causing me, I think, to be very, not having any energy.
Okay, it's unlikely, but go on.
It's coming out, seems like all over my body. I do a lot of work outside, and I come in, I'm wringing wet with sweat.
Okay. All right. So
It's a terrible, terrible odor.
how old are you?
82.
Oh, 82. Yeah, you did tell me. Okay. There are
Right.
there are a bunch of things that can cause fatigue, okay, especially in somebody in at your age, in particular in Florida in this heat. So if you're out there working and carrying on and you come in and say, "Hey, I'm tired, I'm wringing wet." God bless you. You're probably healthier than I am. Okay? Now, with regards to Manila, okay, you can end up with manilial overgrowth, but it's rarely the cause of much more than burning of the mouth and rear end. Does it smell? The answer is it can. You'll feel it if it's in your sinuses. You'll smell like you're smelling funny. But far more likely, if you're sensing an odor about yourself, it's not going to be fungal. The skin, okay, is the largest organ of excretion in your body. In fact, it's the largest organ in your body anyway. And so if let's say you're dehydrated and you're starting to excrete urea, ammonia, you're going to start to stink funny. Okay? So what I would do before I did anything goofy with you or anything fancy with you, I'd go out and buy myself some betadine scrub. This is a soap. We use it surgically. And you can buy it at Walgreens or CVS. You can go on Amazon, okay? But it's called betadine, Betadine. Okay, and so the story is, or betadine if you're from the UK. So what you do with this stuff is you get into the shower, soap yourself up regularly, then step back from the shower and scrub yourself with this red orangish stuff, this soap. And what it's going to do is it's going to knock down the bacterial count on your skin. And if you start smelling less, what I will tell you is that it's probably a dispopulation. It's a dysbiosis of your skin bacteria. And if that's the case, it is very easily fixed. But do I think you need to be going on magic, what they call the magic mouthwash for Manila? No, it's very unlikely that's the case. So before you do anything goofy, get yourself some betadine.
Stuff in the store, won't touch it. And now, it's bothering me on my ankles and my feet.
I got you.
It's itching like crazy.
Well, this is one that I may want to look at, okay? Because if Manila doesn't do that either. Manila doesn't itch. But,
okay.
Yeah, but there are other skin infections that can. So if you don't live that far away, okay, you're right down the street from me actually. So give Iris a call tomorrow. Okay, she's at 407. Okay. Do you have your pencil out? 407.
I got it.
407-679-3337.
679-3337.
Okay, and talk to Iris. Okay, Iris will answer the phone. If she doesn't answer it right away, it means she's on with somebody else.
Just call
Just
back.
call again. Yeah. And tell Iris that we chatted. Okay, and then tell her that I thought it would be a good thing if we got you in tomorrow or the day after. If you're a loyal listener of ours, then we will get you in quickly. Okay, it's not a big deal. Let me look at it and take it from there, because this is one I want to look at. I mean,
Okay.
Do I think it's fungal? Could be. I mean, I have three patients with a fungus called Sporothrix shankia that they got in their garden. Okay, one of which was one of Melissa's longtime listeners.
Oh, yeah.
Okay, and this guy had this thing for years and years and years on his hands, cleared it up. It took a year of the medication. Okay, I
Took a while
told
to
him
get it
it
down.
was going to take him a while.
Yep.
But yeah, the likelihood of that being you is pretty small. But in any event, give Iris a call tomorrow and we'll get you in.
Fantastic. Again, the line is now open, 407-422-1212. If you should run into a busy signal, call again or text us. Haven't even mentioned that. You can text us at 23680. We're also on social media at Stages of Life Medical Institute. Go to stagesoflifemedicalinstitute.com for more information. Stages of Life Medical Institute is at the intersection of I-4 and 434 in Longwood. Be right back. Stages of Life Radio on News Radio WFLA Orlando. Yay! Look at that. You got collars and everything.
Hey, it's working fine. And nobody has made a crack about my shirt yet. Okay.
Oh, no, it's quietly. I haven't checked the text line.
Yeah.
So-
Where's your Stages shirt? No, actually, I'm wearing a Harley Davidson Hawaiian shirt.
Yeah, you are.
I got this in Maui.
Very nice. Okay, we got some questions here for you. So, Keith is checking in. Says, I have a slip disc pinched nerve in my neck, C7.
All right.
with a dull pain that radiates into my shoulder and sometimes the fingers of my left hand. I had a steroid shot around Christmas Eve last year that proved some relief immediately, but the pain eventually subsided completely about a month or so later and now has reappeared. I was wondering how many times I can do the steroid shot. What is the downside, and is there a better treatment? I am not sleeping well because of discomfort.
Good. Okay. First thing I would want to know is which fingers on your hand are bothering you. Because if it's the thumb, index, and middle finger, it may not be the neck at all. There's a nerve back there called the dorsal root of C5 that will go through a muscle called the levator scapulae. It will cause all the above symptoms and make it difficult for you to sleep. You'll find yourself sleeping with a pillow on your chest, holding your arm over it. It's a very interesting problem, and it takes very little time to fix that. How many of these injections can you get? Depends on how heavy-handed the person with the needle is. I like to go in when I need to, and I'll go in with 20 milligrams of Medrol. Okay? When I was in training, we used 4 times that amount. You do not need very much. Why do you care? Because it suppresses the adrenal glands. Not a good thing. So if you did it once or twice a year, it's not a big problem. You start doing it more frequently, it becomes a problem. So, and again, it's called levator scapulae syndrome, Levator scapulae, levator scapulae syndrome. And what you do is you fix it. It's really pretty simple.
You got time. Don't worry. It's just me.
Ah, cool.
Farting
Okay.
up.
Yeah, we're sitting there competing with the music, which is not a bad thing.
It's all
You know,
good. Just
yeah.
we pay for this.
I was a
so we're all
musician at one time. I
right.
can sing too. Actually, I sing very poorly.
Oh, thank you for not doing that.
Yeah, well, I would have. I mean, I have actually in the past, and I did badly at it then.
Well aware. Okay, so we have a few more minutes. We've got a couple of questions actually on the text line, or not the text. Norman, hey, he's got an uncircumcised situation. Stay away from strippers. A lot of fungus. I went over.
Sounds like he has some experience with strippers.
If I had a rash and I rubbed it, it would feel better. Hey, am I shut out? No, you're there. Okay, I have half a leg that is shrinking. What can I do? I love my stuff. Norm,
Yeah.
are you drinking?
Yeah.
Sarah has
He's
a...
dreaming is what it sounds
Really?
like. Yeah.
Sarah, he's my buddy. Sarah Gray says, are varicose veins always bulging or very visible?
Not always. Okay, you can have superficial varicose veins. You can have deep. Sometimes the varicose veins appear like something called hemorrhoids. Okay, those are also varicose veins. And not infrequently, if you're an alcoholic, you'll see them in the abdomen, and sometimes they appear around the belly button. So they're not always visible. But who cares about them if you don't see them, right? Okay, now that's not the same thing as the spider veins. Spider veins are not varicose veins. Those are actually a different problem, treated very, very differently. But sometimes you see the two together. 35. They do get treated differently. So spider veins, that's one thing. Varicose veins hurt.
Do they?
Spider veins itch. Yeah, it's actually kind of an interesting differentiation. That's one of the ways you can tell them apart.
Will potassium help?
No, but something called horse chestnut can. Okay, now there's an herb called horse chestnut. Okay, so Melissa here thinks this is very funny. It's actually quite, it's about 450 milligrams a day is the dosage.
Stop.
What do we got?
We have to play radio.
Oh.
Norman. Good morning. Welcome back. How are you? It's actually afternoon. Stages of Life Radio here, brought to you by Dr. David Klein, who is the man. Okay, so, you mentioned earlier about singing. Norman, who's watching us on our Facebook Live
singing?
feed at Stages of Life Medical Institute, says he hopes that you sing better than the shirt.
What now? Wait, I should not have said anything about the show. We would have made it through the whole...
You would have made it.
But we would have made it through at least another segment with it.
So if you have a question for the doc, 407-422-1212. If the line is busy, please try again or text us your question at 23680. We do this every Sunday from 4 until 5 p.m. Eastern Time. And we've got another caller. Let's get to Russell. He's from Orlando. He's 67. He wants to know about Natrethroid for hyperthyroidism.
Hypothyroidism, but all right.
Hypo, and is there a recall on it?
Yes.
Hi, Russell. Welcome to the show.
Hi.
Hey, Russell, how are you doing?
I'm good, Dr. Klein. How about you? I had 2 questions, actually. You switched me to Natrethroid.
Sure.
I don't know if you had seen it. that they've had a nationwide recall. They had to recall 483 lots of it, and the drugstore that I go to doesn't have any other lot except one of those recalled because apparently the dosage is only 82% of what it should be.
Yes,
and so I didn't know if I should just continue taking that or go back to the levothyroxine.
Well, the levothyroxine would be a terrible choice. Okay, so of all the things to do, that's
Okay.
probably the worst choice. If you wanted to switch it to something called WP thyroid, you could go ahead and do it. It costs more. Armor thyroid would be a better choice as well because it's more expensive but less so than the WP thyroid. If you want to go with the NP thyroid, there's another one called NP thyroid, and they've already had a recall once before. So what I'm going to recommend to you is this. You can adjust the medication based upon your lab work. So if something comes in at 82% instead of it being 105%, which is what it usually is, okay, it really doesn't make a lick's bit of difference in the greater scheme of things. You simply draw blood, look and see whether or not it's adequate, and if it is, you continue. The body works on what's called a logarithmic scale with hormones. Okay, in order for you to end up with 10 to 15% more effect from the hormone, you have to about double the hormone strength or double the dosage. So the body sees hormones not in a linear way, but a logarithmic one. So when something's off 15%, it really doesn't seem to make a great deal of difference, which is why it was a voluntary recall instead of a mandatory recall. So what would I do?
Right.
I'd simply get some lab work and see where you are, and that'll simplify it real well. Otherwise, it's going to be a very expensive endeavor for you.
So we have the text line on fire, as a matter of fact, here, Doc. You're
Well,
listening
put it
to
out.
Stages of Life Radio. Is it beneficial to take a probiotic while taking an antibiotic? And if so, which do you suggest and for how long?
Okay, what I'd suggest is you not take the two together. That's like antimatter matter. They will cancel each other out. Or, in any event, the antibiotic kills your probiotic. So the antibiotics are cheap, the probiotics are expensive. Wouldn't you know it? The one that's going to die is the one that's expensive. So you wait until the last day, wait one more day, and then start the probiotics. When you do start the probiotics, you want to take something with it called a prebiotic, which you can either spend a lot of money or you can do as Dr. Dave does, and that's to get something called Del Monte brand zucchini squash with tomatoes. Okay, and it comes in a can, wouldn't you know it? A can costs about $2, and if you buy them by the case at Costco, it's even less. And you take 1 or 2 tablespoons of this stuff every day, and it feeds the probiotic so that it works better. So when you take that probiotic, you do it at lunch, you take a couple tablespoons of this stuff, and wouldn't you know it, you'll save a bunch of money, and I want you to think about me every time you do, because it doesn't taste badly either. So next question.
Are testing machines setting the cycle threshold too high, giving us positive tests that are not infectious?
Okay, setting things too high for a lower limit of detection does exactly the opposite. So if you put the LOD low, okay, for things like COVID, you'll pick up infections where you miss them in others. But that's not even the issue. Okay, the issue is, do you have bacterial pieces? Do you have viral pieces in the case of COVID or not? If you do, it means you have an infection. So the lower limit of detection, the more value you're getting out of the testing. So it's a good question, but I think you're looking at it backwards. So at Stages, through our partner with Florida Laboratory Analysis, we have 2 PCRs. The small one knocks things out quickly. We use that mostly for our travelers. Why? Because they need to be seen quickly. So we'll get PCRs done for people traveling for 8 to 12 hours. We'll get it done very, very fast. But the big Mac Daddy, okay, the big guy, the guy that does a couple thousand tests an hour, has a lower limit of detection of 20 particles per ml, which makes it the most sensitive machine in the country. At Mayo, up in Jacksonville, there's a 695. So ours is 20, there's a 695. So they're missing lots of infections. If you're sick, I think you want to know about it. Now, with regards to false positives, if you want false positives, go stand in line at the convention center. All right. Now, why do you think they have so many people that are saying, "Hey, wait a second here. I drove out of line. They didn't even test me, and I got a letter that says I'm positive." You know why? Okay, that is a problem because they're not labeling the samples. They're not mating them up to the person getting the test done. So the biggest problem with the testing that's out there has nothing to do with the machine. It has to do with the people that are operating the testing stations. So be careful. Okay. You need to know that's where your biggest risk is going to be. So I want you to imagine you have a line of 15 or 20, in that case, maybe 50 people. Okay, and it's going to take you 3 or 4 hours to go through it, right? So each one of you gets a number, 1 through 50. Okay, so But they don't know who number one is, and they don't know who number 50 is. So if one person steps out of line and everybody else moves forward, wouldn't you know it, your paperwork doesn't mate up anymore. So you're going to end up with a bunch of people with wrong data. It's insane what's going on out there, and the joke is that the government's paying for it. So what do we do at Stages? You come in, and we actually fire off labels against the paperwork and against the tube itself. And those two things have to match before anything goes out to the laboratory to be tested. That happens to be the way that CLIA tells us to do it. Well, with this emergency, we're going to suspend some of these regulations. They didn't suspend those. So there are lots of people out there that are missed. Okay, they were told that they were negative when they were positive and positive when they were negative. And if you want to see something cool, look up 25,000 bad COVID studies. I won't say who did it because it's a very well-recognizable hospital system. And what they did was they didn't handle the samples properly. There are 25,000 people that got tested early on in this thing that all had garbage done. So don't worry so much about the lower limits of detection. Let me worry about that. That's my job as a licensed, highly complex CLIA certified laboratory director. Believe it or not, in addition to the other junk that I do, I got to do that. Don't you know?
Ready for another one?
Sure.
My family doctor says there's really nothing that can be done for tinnitus. Do you agree?
It's largely true. Okay, there are a couple things that you can look at. Tinnitus happens as a result of either nerve damage. Okay, sometimes loud noises will do it, in which case you end up with nerve, the nerve endings are fried. Okay, you're pretty well done at that point. If you can catch it early in the illness, you can use something called N-acetylcysteine or NAC. NAC orally will help mitigate the damage. That research was done by the United States Navy, and it works. The second thing are something called phosphodiesterase 1 inhibitors, or PDE1s. The ones I like are it's called vancomycin and huperzine, and they open up the small blood vessels. If it's autoimmune in nature, that is very, very beneficial. Third thing is avoid caffeine. Fourth thing is avoid salt. And as best you can, avoid getting excited, because the autonomic nervous system will make tinnitus worse. So there are things you can do about it unless you don't know about them. If you don't know about them, there's nothing you can do.
Wow.
Wouldn't you know?
Okay, anything that you've heard referenced here, medication-wise, nutraceutical-wise, you can find at stagesoflifevitamins.com. You can always give them a call. 407-679-3337. We'll be back with more Stages of Life Radio with Dr. David Klein in just a couple of minutes. This is News Radio WFLA, Orlando. This is actually only a 2-minute break. It's just me. Correct. Okay, so anyway, let's get back to Norman's problems. Just kidding. Where do we start? What was the can of fruit, vegetables called, by the way?
It is called Del Monte. That's the brand. Mm-hmm. Zucchini with tomatoes. They used to call it succotash.
Yeah, it was succotash.
Yeah, but they called zucchini squash with tomatoes. Okay. And so why? Because the tomatoes and the squash, the bacteria in these probiotics love it. So they'll eat it. It's like sucking down fertilizer for the probiotics. Now, when you do take probiotics, and this goes for everybody, you don't take them on an empty stomach. If you do, it's like dropping a fizzy into a Coca-Cola. Okay, it just kills them. Okay, the stomach acid goes and it's gone. Okay, so you have to take it with food, and it's best taken with the type of food where the little suckers can hide. Something called Del Monte brand zucchini squash. Okay, and that's just the way to do it, and you might actually enjoy it. It's good for you. My mom told me that.
My mom told me. Norman says he was in the Navy too, and a lot of times there's just nothing more that you can do except. Really?
Yeah,
thank you, Norman.
Yeah, thank you, Norman. Yeah, shore leave. Yeah, I gotcha. Line up.
What you can do.
Man, we did plenty of that.
Mm-hmm. So I know there's
Navy was fun. Air Force was less. The Navy guys know how to have a much better time than the Air Force folks.
Oh, God. Let's not even start about coasties either.
Oh, well, no.
Half of them can't even swim or row a boat. So, I'm serious. All right, what do we have here? Hey, Karen. Thanks for joining us today.
Coasties.
Yeah, coasties. They're terrible that way. 20 seconds. Why only 20 seconds? Okay, guess I'll just do what I need to do. Forget the show. Get away. I know, right? Hey, well, I have to make up for things not being the way.
Yeah, I forgot you were from New England. So you had to put up with a bunch of those folks.
Mm-hmm.
Yeah.
Coasties.
Mm-hmm.
Suck. Here we go. See if I can get it to work. Welcome back to Stages of Life Radio. Well, the Fingers and Hopper Popper group there, they were like, no, go now, go now. And I was like, yes, go now. And then they took a second and counted down. It was weird. When you have a live band in the studio, I'm just saying,
tough.
Dr.
It's
Dave,
tough.
it is tough. There's
Yeah.
just so many people and
Musicians
everyone's
union you have to deal with. It's terrible.
attitudes. It is. Welcome to Stages of Life Radio every Sunday afternoon from 4 until 5. You can catch us on 540 AM, 93.1 FM if you're south of Orlando, 94.1 FM if you are heading towards Volusia County, and of course all across the peninsula on AM 540 and across the world on the iHeartRadio app.
Yes, you can hear us wherever you happen to be.
That is Dr. David Klein. He works his butt off at Stages of Life Medical Institute. They're at the intersection of I-4 and 434 right here in beautiful Longwood, Florida. You can always check them out at stagesoflifemedicalinstitute.com. You know, we're taking phone calls, and a lot of them so far have been very interesting. 407-422-1212, or you can text us 23680. Doc, you started off the show talking about how to embrace anti-aging and things like that. So how do we deal with that?
Okay, well, the first thing you want to look at is what your current situation is. Okay, you do an assessment. You take an inventory. That's best done by a third party, somebody else other than you and your spouse. Why? Because you really have to be a little objective about it. Most of the work that's done is done through blood work. You do a history. It's a good thing to know what your past is all about. The more complete, the better. Physicals give some information, but the real big deal is through the blood work. Now, there are a lot of people out in the industry that do saliva testing, which is a joke, actually. But you know, blood work is what it's all about. You see what is floating around and what the command and control mechanism called the endocrine system thinks is happening. And that will give you 90% of the data that you need to start heading in the right direction. Because so much of the rest of it happens statistically. So what do you think the likelihood is of you being vitamin D deficient? That's not D2, okay? Not the prescription vitamin D2, which is junk, but the over-the-counter vitamin D3. The answer
Probably
is
a good chance.
40%. Okay, 40%, even here in the state of Florida. Lots of sunshine, the Sunshine State. 40% of the population is vitamin D deficient. Why?
Gosh.
Because you might be vitamin D2 deficient, and your body makes vitamin D3 from vitamin D2 with the sunlight. So you can fry out there. Nobody's going to care if you're D2 deficient. You're still going to be D3 deficient at the end of the day. Vitamin D3 is a selective estrogen receptor blocker. So for guys, you can become a little bit more manly, like me. And if you're, if you're a gal, it will reduce your risk of breast cancer. Guys, it reduces the risk of prostate cancer. It's a marvelous hormone, and it costs about $6 a month or less. So you start there. What minerals do you think you're deficient in? The most likely one is going to be magnesium. Another 40% of the population is magnesium deficient. So what are you going to do? Go run out to the box store, ask them for a bottle of magnesium? You're going to find, okay, that magnesium, just like iron, and we talked about it earlier, has to be taken in certain forms to do certain things. If you take magnesium citrate, that's magnesium, sure enough, but you're going to poop all over the place, and you're not going to do much for your magnesium levels. If you take magnesium oxide or carbonate, that's chalk. That's the stuff you probably have. That will just end up passing through the gastrointestinal tract and just simply end up in the water supply. So what do you need to do? You need to know which of the moieties, which of the chelates, which of the salts, as it were, are the ones you want. And it depends upon the circumstance, because if you're smart about this, you'll get more than one bang for your buck. So let's say that you have a difficult time sleeping. Magnesium glycinate is the best one of the bunch, because you end up with magnesium and you end up with glycine. Glycine is a soporific. It will make you rest. Let's just say that you needed a little problem with your eyes. You'd take magnesium taurate, because the taurine will reduce your risk of senile cataracts. So you want to pick what you're doing. Let's say you have fibromyalgia. So magnesium malate, because the malic acid is a muscle relaxant. So you got to figure all this out. So you need to know what is in your best interest, and then you start picking and choosing from there. So we do all kinds of things, like checking your growth hormone level. And you're going to go, why do I care as an adult what my growth hormone level is? As there actually is a desirable growth hormone level in an adult. If you don't have it, your immune system goes to hell. Now, in the COVID environment, that might put you at risk, wouldn't you know? Growth hormone also helps with joint regeneration, as well as a bunch of other things like depression. So you can put somebody to sleep. Okay, knock them out because they have a hard time sleeping. And if you use lactoferrin-containing colostrum, you'll actually also kick up their growth hormone levels. And if you're a meathead, a musclehead, somebody that likes to work out, you know what you're willing to pay for that growth hormone, now don't you? Somewhere between, for the over-the-counter stuff, $70 to $90 a month.
Oh my
if you get
goodness.
the injections, it's $1,000 a month. So using the lactoferrin-containing colostrum, it's $30 a month. It's a very, very different thing. So you can either use you can either learn this stuff over the course of decades, or you can ask me. And I'm here every Sunday from 4 till 5 p.m.
It's true.
So I hope that made some sense.
It did make some sense. I understood it. Now, briefly earlier, you mentioned something about people who need to travel getting the rapid COVID
Yes.
results so that they can get the heck out of Dodge.
We're probably the fastest ones in the country doing it right now.
Okay, give us the skinny on that.
So,
one.
okay, the deal here, okay, is that you have 72 hours from the time that you've got to leave, okay, and when you're going to have the result of this study. Very narrow period of time. So if you're going to the Bahamas, they tell you that you have to have a PCR no earlier than 72 hours before you leave. Now, if you're out there reading the newspapers, well, it can take 5 to 7 days to weeks, okay, to get the results back. So what we did is we started something called travelpcr.com. We started it last week, actually. I did this between patients. So what do? We bring people in. We get the sample and we send it to the Jacksonville office through what looks like a marathon. Okay, it gets handed off to person to person to person, so it kind of flips all the way up to Jacksonville and gets done that night. So if we have the sample by 11:30 or 12 o'clock in the morning, we can result it by 3 o'clock in the morning that next morning. Now, will that get you where you need to go? And the answer is yes. You'll get the results by text message and email. Your email will have your certificate, everything that you need to travel. So you can reach us at 407-679-3337, and we'll talk to you about where you have to go. If you're locally, Longwood might be the best bet. If it's a little later in the day and you have to go quickly with it, we'll direct you to St. Augustine or our Jacksonville office. So the COVID hotline is 407-636-3945. That's 407-636-3945, and we can, in fact, take care of you. In the meantime, okay, if you need, if you're interested in getting better, if you're interested in feeling well, you can reach us at 407-679-3337. That's Stages of Life Medical Institute. There's one doctor there, and it's me. It's a great facility. It's clean. It's nice. It's not always that quiet because I laugh a lot.
Yeah, it's loud there sometimes.
We have a blast.
Hey, quick question we can squeeze in off the text line.
Sure enough.
What blood tests are needed in an annual exam?
Okay, most people end up with a CBC. They'll end up with a liver and a lipid panel. That's all that most people ever get. When I do it, we add hormone panels to it, thyroid panel to it. We'll end up with autoimmune panel as well. And insulin, because otherwise you don't know if you're going to pick up diabetes until it's too late. Good question.
Well, I hope you guys learned a lot this week. If you didn't, of course, we'll be back next week at 4 o'clock. Oh, it's so much fun hanging out with Dr. David Klein. Stages of Life vitamins for any nutraceuticals reference. And I'll catch you in just a few more minutes.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.